All right, so yesterday we started talking about epithelial tissue. Basically what we're discussing here is building a wall. I think that was the analogy we used yesterday. We have a couple of different terminologies that we can use. Simple means the wall is only one brick high. Stratified means there are more than one brick high. And then we have the shapes of our bricks. We have our squamous, which are squished, very fragile. We have our cuboidal, which are cube-shaped. We have our columnar, which are column-shaped. So then we started talking about these configurations. We have the simple squamous, one single layer of squished, fragile cells. Is this really creating a barrier against anything? Of course not. This layer configuration is going to allow gases to go back and forth very easily. We're going to see this in the mesothelium. I think everybody who's been up at 2 o'clock in the morning watching infomercials, there's nothing else on if you have cable. If you are a loved one. Mesothelioma. Mesothelioma. What is oma? Tumor. So a mesothelioma? A tumor in the lining of the chest, which is not good because then your gases don't get exchanged. Endothelium, the lining of your blood vessels. Well, that's where you are dropping off oxygen and picking up carbon dioxide. So we don't want a big barrier. We want that gas to be exchanged very, very easily. Simple cuboidal, we have a single layer of cube-shaped cells here. This is going to occur in area where secretion and absorption. Secretion means to put out, absorption means to take in. This is going to be found in the ovaries, the kidneys, the pancreas. So very specifically where we have secretion and absorption taking place. Our simple columnar, a single layer of column-shaped cells, these are going to have very increased surface area. So these are going to be lining the GI tract. The job of your small intestine, so when you eat Chipotle burrito, oh, I might have to get a Chipotle burrito for dinner. Oh gosh, that would be delicious. I love Chipotle, by the way. You're eating your Chipotle burrito. Well, your body doesn't know how to use any of that stuff. It's alien. It's alien material. So your small intestine's job is to break it all apart on a molecular level. Upload those molecules into the bloodstream. The bloodstream takes those molecules to the liver. The liver converts it into energy so that everybody's getting paid. I need a lot of surface area to have that happen. So that's why I have these larger, longer cells to increase the surface area. And then, of course, I have my goblet cell, which produces mucus. Game of Thrones, drinking the lung butter.
I don't know why when you told that story, I thought you were talking about blood clots.
No, I was talking about like the lung snot that you cough up in the morning.
No, you're talking about.
Yeah. Oh, that's a good descriptive term, isn't it? Lung snot. Yeah. Lung snot. Every morning, because my allergies, and you get that postnasal drip all night long. And then you're just congested and you're coughing it up and ugh. So gross. It's so gross. All right, so the next three configurations is where we have multiple layers. We have our stratified squamous. So we have multiple layers, more than two, or more than one rather, two or more, of squished epithelium. The number of layers is dependent on where it is in your body. For example, the number of layers on the bottom of my foot is very different than the number of layers on my eyelid. Thank goodness, that would be gross. And these cells originate at the basement membrane and are created, and then they bump everybody up a layer. So when the top layer is shedding, there's a layer right underneath to take its place. We shed a tremendous amount of skin cells every year. Every speck of dust in your house is dead skin cells. That's gross. That's disgusting. You shed about 2 pounds. 2 pounds of skin cells per year. Yeah. And then there's another layer right in behind it. Now, if you have an area on your body that is receiving repeated trauma, right? Like you play guitar. I don't know, did we get to this slide yesterday? We talked a little bit about like guitar playing. Because if I am traumatizing the tissue, my body's going to try and create a barrier to prevent that from happening. So what's going to happen? I'm going to form a callus. It's the same thing on your feet. When you go get a pedicure, although I've not gone to get a pedi since like March. Miss it. I miss having real life. But they take the cheese grater and they and like you just have chunks of skin falling off of your feet. It's disgusting. And it makes your feet feel super nice and smooth. But it's traumatizing. And so what's your body gonna do? Lay down even more tissue. So the next time you go and get the cheese grater, there's even more tissue. And the next time there's even more tissue. It's like every time your body creates this barrier and you get the cheese grater, I say cheese grater because that's what it kind of looks like. Anyone who's had a pedicure knows what I'm talking about. But like your body's like, okay, look at all this trauma. We're gonna build it stronger, and then, and the body goes, come on, come on, build it more. And so the more you actually go get pedicures, the quicker and the thicker the skin will grow back. So it's one of those where if you go get a pedicure, you are now committed for the rest of your life. Oh, I see.
I should.
I used to go, like, it was my treat. I'd go about every 4 weeks or so and get a mani and a pedi and just treat myself. And then, oh, I almost said a naughty word. I did. I almost said a naughty, and then I realized where I was. COVID. Those of you who are psychically connected to me right now, I apologize for the profanity. I do apologize for the profanity. So this stratified squamous is constantly being worn away. Constantly being, like in the mouth. You're chewing, you have saliva in the esophagus, the vagina, the rectum, and then of course your actual epidermis and dermal layers.
So,
Yes.
so like, I don't want to compare it, 'cause this is weird, but it happened in my head, so whatever. So with the feeling of the foot and then periods, we're constantly like deteriorating the lining. Does the same thing happen like after a period? Does the lining come back stronger, or is it just like?
No, because it's not trauma. So it's no different than, no, this is a fabulous question, by the way. I'll give you a unicorn high five. So when you have smooth muscle, right, your uterus is smooth muscle, your small intestines are smooth muscle. Let's take the uterus. We have prepared for the implantation of a fertilized egg. We have built it a little nest. We have nurtured it. We've created all of its favorite foods. We have this amazing bubble. And then the egg comes down and it comes in, but it's not fertilized. And so the body's like, well, get rid of that one.
So little memes of like it's just traumatizing, like it's a tantrum.
It's not a tantrum.
But it's funny.
Here's what
I
happens.
know
So
it's not.
you have hormones, obviously, right? You have one hormone that tells the uterus, an egg is coming. and we build, I really do, I think of it like he's building a little nest. And then we have another hormone that says, release the egg. And it goes into the nest. And then we have somebody come over and look at the egg and go, nope, not happening this time. And then we have another hormone that says, get rid of the egg. And we have these peristaltic contractions. Every preparation is removed. And then we have a hormone. Get ready for the egg. And it starts all over again. This is not trauma. This is not like picking a scab over and over and over again. This is a natural, normal body a process. Now, if you have unnatural trauma over and over and over again, then yeah, you can, and that's where you would get, let's say, ovarial cyst, uterine cyst. A cyst is just an area, it's like an inside blister. Like you're wearing your shoe, you get a blister. Inside, we have trauma, we're gonna form a barrier. But same idea, but it's not thickening up the tissue. Does that make sense? Did any of that make sense? Okay. I do. I just release the egg. This little egg just burp, 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 burp. Multiple layers of cube-shaped cells. Usually we're going to see this in 2 layers, which still is stratified, right? Because anything greater than 1 is stratified. And we're usually going to see this in what we call excretory ducts. What a duct, that's not duck, quack, quack. That's duct like the ductwork in our ceiling. Ducts are small tubes that transport stuff around your body. No different than you have your air conditioning unit on the outside of your house. How the holy heck do we cool the house? You have the ductwork that brings it in and deposits it into the individual rooms. In your body, those ducts would be made of this stratified cuboidal configuration. Yes.
Kind of off topic with that. Because we're also doing, well, we're about to start what actually, but we kind of just extend and, if I remember correctly, mentor. Or is, like, are we learning the systems in there and in here? Like, it seems like we're learning the same thing with class.
Yes.
So I just wanted to, like, know what the difference is.
So here's the difference between the 2. Medical terminology, I know it seems like it's, you know, really, I'm gonna itch. We're really mimicking the same stuff you're learning in here. Medical terminology, though, we are far more concerned with you knowing the terms. In here, we're concerned with you knowing the process behind it. So I know that once you get to the end of Mentorm, it's almost like an A&P light. It's almost like an anatomy light. It does not go into nearly as much detail as we go in here. So like when you went into the bones, I bet you covered, oh, you guys have a test coming up, don't you? You went into the labeling of the individual bones, right? You went into compact bone versus cancellous bone. The next chapter, what we do for bones is we go 2 steps deeper. We're going to talk about Haversian canals and Volkmann's canals and nutrient foramina. We're going to talk not only about the humerus, but we're going to talk about the greater and lesser trochanter at the proximal end, condyles at the distal end, that then articulate with the trochlear notch of the ulna.
Yes, that's literally just what happened.
That is how, so the great thing that we've done with this curriculum, and that's why I'm very, very proud of this curriculum. We coordinate so that just as anatomy is getting into a topic, you've just finished it in midterm. So you've already got at least a basic foundational knowledge. So I'm not having to reteach you what is cancellous, but we're going to go over it. but you already know the terms cancellous, compact, epiphysis, diaphysis, right? You know humerus, ulna, radius, carpus, metacarpals. There you go. Tibia, tell me the part of the pelvis my hands are. The ilium is a sassy bone. The part that you're wiggling on right now. We're going to be going, though, into much greater detail. But the fact that you already have that foundation makes anatomy so much nicer. Oh, I thought I was going to catch it and I didn't. Stratified columnar, quite frankly, are just very, very rare. We do see them in some configurations in our bovine. In the reproductive system, we really still stuff all.
Just Germans. You stood on yourself earlier.
Oh, did I do that earlier?
Yeah.
I didn't even know. Oh, was it?
Whenever you kind of dropped it, you had Germans.
No, it's fine. I just don't want to get it all over my tongue. So we can see it in some bovine, but honestly, you can just put very rare. Very rare. And those are the 6 configurations of our epithelial cells. We have our 3 simple configurations and our 3 stratified configurations. Is everybody okay with the premise and ideals behind these? Everybody still on the bus? All right, now we got a couple of guys that don't fit into the mold. Pseudo-stratified, tell me what pseudo stands for. Fake, false. He looks like he is multiple layers, but he's not. He's a single layer. What's happened is his nuclei are at different levels, and it gives it the appearance that he has multiple layers. So although he looks like he is stratified, he's not. And that's why we say he is pseudo-stratified. And then these cells are usually ciliated. Sea anemone, right? Crowd surf. We see these cells most commonly in the trachea and the respiratory tract. These are the cells that crowd surf the lung butter up out of your lungs. So when your lungs are producing mucus, because your lungs produce mucus, quite frankly, all the time. It's one of the kind of safety protocols. So what happens is you breathe something in. Okay, it could be pollen, it could be a virus, it could be bacteria. And it starts creating a little bit of trauma in your lungs. And your body says, oh my God, well, that's not good. We should probably go ahead and create some sort of barrier between that offending thing and our delicate tissue. So it starts creating thick mucus, because then the idea is that the virus, the bacteria, or the pollen gets stuck in the mucus like quicksand and can't do any more damage. The problem, though, is you can't breathe mucus. So we got to somehow get rid of the mucus. So we've got the cilia that are going to now move this little mucoid bunch of offenders down into the lower part of your trachea. And then they go tickle, 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 and you, and then you swallow it. And then it goes into your GI tract, into your stomach, where we have hydrochloric acid, and it just basically disintegrates anything that goes in there. Unless, of course, you have a cheeky monkey like COVID. And this is what is making COVID, I know that I'm not, nope, Doug, do not, no. That's why GI issues are now thought to be one of the symptoms that you can get with COVID. You breathe in the COVID, it first creates respiratory. horrible, horrible cough because your body's trying to expel it. Tons and tons of mucus, hence the pneumonia. You swallow it, and where most viruses hit that hydrochloric acid, and just like the witch in the A Wizard of Oz, you know, I'm melting. COVID's like, bring it. Let me at that small intestine. And then guess what? Now he's got access to your blood. Where does your blood go? Right there. Now you have a systemic viral infection. That's terrifying. That's terrifying. So, pseudostratified, my whole point is usually found in the respiratory, and the ciliated are going to help to crowd surf any of our offenders out of the lungs. And finally, we have our transitional. Now, what does transition mean to you? To change. Very good. To change. Transitional cells have the capacity to change. They can stretch. They form a leak-proof barrier. So like in your bladder, when your bladder is empty, it is very small, just like an unblown up balloon, straight out of the package. The walls of the balloon are very, very thick, and the balloon itself is very small, but then you start blowing it up, and it gets bigger and bigger and bigger. What happens to the walls of the balloon as you blow it up further and further? They get thinner and thinner. That is all having to do with the capacity of these cells to stretch and change their shape. And then when you go and empty your bladder and it shrinks back down to normal, this is again specifically because of these specialized cells, these transitional cells. So that's where it can stretch. Now, it does not have an infinite capacity to stretch, because what happens if you overfill a balloon? Yeah, what happens if you overfill a bladder? It explodes, it pops, it ruptures, and spills urine into the abdominal cavity, and then you're looking at a dead animal. All right, now we have some glands that we're going to talk about. We've got two categories of glands. We have endocrine. Endo means what? Inside. Endocrine glands deposit hormones, because that's what they create is hormones, into your blood directly. These hormones are going to create body-wide changes. So some of our endocrine glands, and we don't go into a great amount of detail in these. You will when you get to the endocrine system. You got your pituitary gland, which is the master gland, thyroid, which controls your metabolism, parathyroid, which helps to control glucose. We've got adrenal gland, which produces adrenaline, among many other things. Kidneys, pancreas, ovary. This poor cat is jacked up because he's got both ovary and testes. Hermaphroditic cat. These are the primary glands, and the big thing about endocrine is they deposit their hormones directly into the blood.
Do dogs and cats have pineal glands?
They do, except that the pineal gland, as they mature, fades away. So the pineal gland is really only seen in young, immature animals. Exocrine glands deposit their substances anywhere other than the blood. Salivary glands, sweat glands, sebaceous glands, anal glands. We have oh my God, what are they called? They're on the antlers. Anyway, on like deer, because they rub and mark.
The velvet?
Not the velvet, these are actual glands. I can't think of it. Cats have what are called circumoral glands in their lips. That's when he comes and bumps against you, he's not telling you he loves you. I hate to break it to you. He's going, hey, that's mine.
Same thing.
That's mine. You come home and you smell like other animals. Well, that's not good. So he's going to start reclaiming you. Those are called circummoral. But anything, literally, if it's depositing its substance anywhere other than the blood, it's an exocrine gland.
Did you say it was, it deposits hormones anywhere else but the blood?
Anywhere but the blood. Now, the big thing about these exocrine glands, other than they do not deposit stuff into the blood, they have a duct. They have a little hallway. So here I have my gland, and I have a little opening where I can just go and deposit the stuff from the gland. Endocrine glands do not have a duct. They have a little bed of capillary blood vessels that come and pick up the hormones from them and then deposit them everywhere within the body. So where we see full body changes with our endocrine, because where does blood go? Everywhere. Exocrine glands are going to be localized. I have a sweat gland, and that one sweat gland affects an area immediately around the sweat gland. Very localized. The one exception to the rule is our darned old goblet cell, and I'll talk about him here in a second. Comments, questions, concerns so far? Everybody's okay so far? Incredible. Of course, there's got to be one guy that doesn't follow the rules. Gosh darn it. My goblet cell. He is an exocrine gland, but he does not have a duct like every other exocrine gland. He is a ductless exocrine gland. So although endocrine glands traditionally are the ones that do not have a duct, exocrine goblet cell also fits that physiology. And obviously creates mucus. Give you guys a minute. What is the wide muscle in my back called? The latissimus, wide dorsi back. What about the straight up and down muscle in my belly? The line going down, dividing me into right and left half, absolutely linea alba. I'm talking about the muscle that has its striations going craniocaudal. Rectus, straight up and down. How about this way? Yes. How about internal, external, obliques? Oblique just means slightly askew. Good. All right, let's talk about some glands. These are exocrine glands. They are depositing their substances not in the blood. We have 3 different types of glands, and they are classified by how do they secrete the stuff that they've created. Murocrine gland creates the stuff, has this little muscle contraction, and just basically squeezes it out. Apocrine gland, I'm going to draw pictures here in a second. Apocrine gland, apo means what? Medical terminology. What is apo? Oh, maybe I'll just tell you what it is. How about that? Apo is derived from. So apocrine gland, the top half of the cell is released, and that's what takes the substance with it. Holocrine gland, the whole cell is released, and the whole cell carries the substance out of the gland. So let me give you some visual representations of this.
Miss Huff, you missed like 2 slides.
I did?
The
You might not. You're probably on the one that is not condensed. I am on the one that says testable material.
okay.
All right, so when we are looking at these glands, here I have my gland. And I'm creating secretion, secretion, secretion. I do a little bit of compression on either side, and bloop, 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 out it comes. The way that I remember Miracrine is there is no cellular sacrifice. The gland remains the same. There was a show, it was pretty adorable. It was called Meerkat Manor. Has everyone at least heard of it?
Yes.
I used to love
Manor
watching that show.
show was like drama. It was so dramatic and it was so stupid. These little meerkats, though, you don't have to have watched the show to understand my analogy. Little meerkats come out. Imagine they are the secretion and their den is the gland. This little meerkat comes out, looks around, off he goes. Does the den collapse and destroy behind him just because he's left it? It does not. Miro, I think meerkat, which reminds me that the gland remains intact even after the secretion is released. Does that make sense to everybody? Apo. Now I have my gland.
Miss Huff, I'm sorry. Can I ask a question about the Merocrine?
Yes, of course.
So would that be something like if you have a sebaceous cyst, so even though once it's released, it will still come back?
No, because what you're now talking about is a cyst, not a gland.
Okay.
I'm talking about normal glandular tissue. You're now referring to a cyst, which is an encapsulation of some sort of inflammatory response.
Okay. Makes
Does
sense.
that make sense?
Yes, it does. Thank you.
So these are cells, by the way. I'm drawing it terribly. These are cells, and it's these cells that are creating. And when I get ready to release the creation, I actually release the top part of the cell, and that's what is secreted. Apo derived from, I'm sacrificing the top part of the cell. Again, I'm trying to discuss normal glandular activity. Let me put a pin in that for a second and I'll explain. Finally, I have my holocrine. Again, I've got cell, you get the idea. Here, though, I have like 2 layers. Holocrine, here's my stuff. I sacrifice the entire cell. Holocrine, I sacrifice what? The entire cell. So Miracrine, there is no cellular sacrifice. Apocrine, the top of the cell is used as a transport vehicle. Holocrine, the entire cell is released and then replaced from underneath. So when I have these glands, I'm discussing right now when they're perfect. Here I have a gland, doesn't matter what kind, Miracrine, apocrine, holocrine, but something has happened to bottleneck and plug it up right here. Well, just because it's plugged up, does that mean that this gland stops producing what it's supposed to produce? No. So it continues to produce, and it's going to get fuller and fuller and fuller. And suddenly now my immune system goes, oh dear, oh geez, we should probably maybe send some people in to take care of that. And then we have white blood cells coming in, fighting what they now feel is an infection. And we're getting more and more bulging right here, bulging until you take your fingers.
Is that the pain you'll feel sometimes before you get a pimple is like the gland itself really because something.
Yeah, the gland is infected, inflamed, and has an inflammatory response. And your epidermis, there's a lot of nerves underneath there. And so if you are squeezing,
No, like when it's growing. Like before it's actually
oh,
like-
absolutely. So pain is never normal. Even a twinge, pain is never normal. Pain is always your brain, your body trying to tell you something. That is telling you, okay, we have a little infection right there. This is something you might want to pay attention to. It's like your brain, I really see my body and my brain as two separate people. And my brain is going knock, 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 knock. Hey, you feel that thing on your face that's growing? Okay, I'm doing my best. I've got the military going. I've got the fight started, but we're gonna maybe need you to address it from the outside if you could. And then you do. So the pain is just warning you something is wrong. And that's a pimple.
I thought it wasn't okay to talk about it.
It is not. It is technically not, although everybody does it. I'm not going to walk around with a giant white head on the middle of my forehead. But the reason why is because you've already got an infection, inflammatory response. If I cause more trauma to the area, I'm just going to make the response even greater. All right, we're going to pick it up here on tomorrow. We're going to start with connective tissue. I would like you guys to read ahead. And we'll be finishing up and doing all of that. You all have a fabulous, most wonderful day. Good luck on your test.